Hello, I'm Dr. Debapriya Mondal. I'm a consultant medical oncologist at Fortis Hospital, Kolkata. Today we are going to discuss about targeted therapy in cancer. To understand targeted therapy, I often take the analogy of the card game. So most of us know card game. In card game, if we have two players, one player plays his or her hand, and if we have a card against it, we can possibly win this set of game. Targeted therapy is also much like a card game. In targeted therapy, we first test for specific genetic alterations. So those are alterations at the level of our DNA and RNA, which gives abnormal signals, which leads to abnormal growth of cancer cells and metastasis, that is spread of cancer cells. So first we test our patients either from blood or from the tumor tissue whether those alterations or defects are there. Some of the commonly detected alterations are EGFR or ALK or ROS1 in lung cancer, HER2 in breast cancer, BRAF in melanoma, and there are various other targets in various other cancers. So when these alterations are detected, we now have drugs to specifically target these alterations, and once we successfully target these alterations and block these signals, we see that the tumor has started to respond. And in some cases, the response of targeted therapy can be dramatic and near miraculous. We have seen patients with advanced stage cancers, very symptomatic, completely bedridden, become disease-free, symptom-free within a span of months. And that is not something we have seen with chemotherapy. So definitely targeted therapy, whenever possible, whenever detected with an appropriate test, is a better option than chemotherapy. So what are the side effects of targeted therapy? Is it completely devoid of side effects? No, it is not completely devoid of side effects, but the advantages are very important. It is an oral drug. Most people do not require hospital admission for it. They continue taking oral targeted therapies at home, and side effects in most cases are very mild and manageable with oral medications again, and side effect management doesn't usually lead to a hospital admission. So those are the great advantages of targeted therapy. What about the cost? Is targeted therapy costly? Again, that depends on the type of targeted therapy we are speaking about and also about their generation. That is to say, for the same target, say for the same EGFR gene, we now have several classes of drug, like a first generation, second generation, third generation. It is much like our telephone or mobile phone 1G, 2G, 3G, 5G. So every generation has superiority over the other. It is more effective than the prior generation. It is generally also more tolerable, that is, it has lower side effects. But every generation generally is costlier than the older generation. So these are the options that dictate the price of targeted therapy. Right now we have targeted therapy that can cost a few thousand rupees a month. Also we have targeted therapy that can cost more than 1 lakh rupees a month. So you need to discuss with your oncologist about what sort of targeted therapy is best for you. Thank you.